And then I will share my screen. All right. So you should be able to see my PowerPoint. If you can't, go ahead and unmute and just let me know. We'll get started. Again, this is like every week for school and health department staff. We will post this on the health department websites, and so it will be publicly available, but we just like to reserve this time for school and health department for question and answers. Make sure you pass any needed information down through your pipelines. And just a reminder, we'll have another call next week, June 3rd, Thursday, June 3rd. But the plan is that that will be our last regularly scheduled call for this school year. You can continue to contact us at the health department, myself, the health officers, your county nurses, whoever's been your point of contact over the summer if you need to. And then as we get closer to the next school year, if there's a feeling that we need to have meetings again, we'll get those started. So some updates since our last meeting. There has been a new MIOSHA rule released. It went into effect on Monday. Pretty much everything is the same. There's just been a couple of changes in terms of spatial distancing. When you have fully vaccinated employees, you do not have to maintain 6 feet distancing. And when you have fully vaccinated employees, you do not have to require face coverings when they're indoors. Complying with those 2 rules, you can do that in one of the following ways. You can require that you have a record of whether or not your employees are fully vaccinated. You can post a sign that says employees that are not fully vaccinated must wear a face covering and maintain distancing. You can continue to allow or require remote work. You can require that everyone wear face coverings and continue to socially distance regardless of vaccination status, or you can do any combination of those 4 things. So that is per the MIOSHA rule update. Now, guidance on masking in schools, separate from that rule, it is still strongly recommended from public health that everyone inside school buildings continue to wear a mask. And you know, the schools, local public health, really whoever, I mean, businesses in general can continue to make their own policies about mask use. There is a guidance document out there from MDHHS that previously was in the FAQ section for the epidemic orders. This is an actual document that they have out there. The teeny tiny print is the part that doesn't apply to you guys, but I just wanted to throw it in there anyways. But recommended face mask use in indoor settings per MDHHS. Individuals, regardless of vaccination status, should wear masks when in classrooms, when participating in indoor contact sports, and then they go on to say in residential care facilities, indoor congregate settings, healthcare facilities, public transportation. And the rationale for classrooms is just that, you know, the bulk of our students will not be fully vaccinated before the end of the school year. And the other that the CDC gives, and they cite the CDC operational strategy, which I copied and pasted here for you again. The CDC also puts in there just the time needed for you to make that policy change and adjustment, get vaccine records, you know, all of that within the next week or 2 would just be logistically difficult. But realistically, I mean, the biggest one is just the majority of your students will not be fully vaccinated. And, you know, that's just a lot of unvaccinated exposures. So again, that's the recommendations for schools. Technically, you can allow fully vaccinated staff to not wear masks, but, you know, that's going against public health recommendations. So you might just need to be aware that some parents may not feel comfortable with that, or some staff may not feel comfortable with that, which of course they can wear their mask then. And it's just the logistics of it might be challenging. But anyway, that's the rules and the recommendations with that. The interim guidance for athletics was just updated this week as well. And the main updates were about outdoor, indoor, and mask use. So they're saying that individuals can gather outdoors for the purposes of sports without wearing a face mask. But again, public health recommendation is that anyone who's not fully vaccinated continue to wear a face mask when participating in any kind of contact sport, whether it's indoors or outdoors. Fully vaccinated individuals can gather indoors for the purpose of organized sports without wearing a face mask. So again, there's a difference between what you can do and what's safest. And this document kind of goes through that. Anyone who's unvaccinated participating in outdoor sport, if they're not wearing a face mask, they don't have to test any more frequently than the once a week requirement. This is really busy, but it's just, there is another frequently asked question in the frequently asked question document in epidemic orders that really thoroughly explains the sports requirements. And I'm not going to read all of it, but what I did do, most of you probably know this, but when you have questions about what's allowed, what can you do in schools, what can you do in sports, things like that, the FAQ documents are a really good place to look. And if you go to the michigan.gov/coronavirus, you click the down arrow at resources, and then this drop down will occur. This is also where you can find the K through 12 school guidance, the sports and athletic testing, and just all the other variety of things available. But down at the bottom is the state orders and directives. Then you'll want to click on the epidemic order tab. Again, this is also where you would find the MIOSHA emergency rules. Most of the extra information from that page has been taken off, so there's not a whole lot of information there other than just the rules now. But again, if you're looking for the FAQs, you would click this epidemic order tab, and they have two FAQs right now. One is for the epidemic order that's still in place, and then they already have one going for the one that goes into effect June 1st. They also have other supporting documents like infographics, and then also the interim guidance for athletics. So just as an FYI, if you didn't know where to find those and you have questions that pop up, they just go into more depth.
Do you have any students
those, legally written orders into more plain English explanations. So I just wanted to make sure everyone knew that that was there. So as I alluded to, there is a new epidemic order that does go into effect June 1st, and that is already posted on that website. There's no longer any discussion about outdoor activities, and that's because there will no longer be any restrictions or rules in the epidemic order applying to those. So there really are no legal restrictions on those. For indoor gatherings, the restrictions are that you should keep it to 50% of the fire marshal limit, or if there's no fire marshal limit, 30 people per 1,000 square feet, or 25-person limit. It's not and, it's just or. So it's greatly increasing capacity limits. And then I couldn't get my index to change. This should be out a little bit further, but section 4A here says that people in indoor gatherings are required to wear a face mask, except as specified in section 5, which I just kind of added here, basically says unless they're fully vaccinated, or that long list of other exceptions that has been unchanged. So it has a medical contraindication, has to take their mask off for eating, different things like that. So if you are someone in charge of a gathering, so, a school administrator, you have to prohibit a gathering you have to prohibit people from gathering without a face mask unless you make a good faith effort to ensure that they meet one of these exceptions by either putting up a sign saying that they have to wear a mask unless they have an exception, asking people who aren't wearing a mask if they have one of those exceptions. Just requiring face masks universally still, which some businesses have continued to do, as you may have noticed if you've been out and about, or just some other policy you come up with. You don't have to ask for proof of vaccination at all. You just have to either put up a sign that says, if you're not fully vaccinated, wear a mask, or however else you choose to deal with that. So again, Section 5 I mentioned are the exceptions to face mask requirement. The only new one is if you're fully vaccinated. The rest are all unchanged. So the orders are a lot shorter than they used to be. Otherwise, if I didn't write it here, it's all essentially unchanged or things have been taken out. But I think these are the most important things that affect you guys. This is just a reminder. Last week we did go over some changes in recommendations or allowances that would allow you to waive traditional quarantine in your students. I had emailed it out to everybody on our mailing list last Thursday morning, and then we reviewed it at our meeting last Thursday. If you don't know what I'm talking about, or you didn't get a copy of it, one location you can find it is at the District 10 website. It was just an easy place I found it. So if you just go to dhd10.org/coronavirus/school-guidance, near the top left section of that page, you'll find a bulleted item that says new, and then it says K through 12 criteria to waive quarantine. So it is listed there. As a note, we had gotten that guidance out a bit earlier, knowing that the state would be coming out with very similar guidance. That guidance did come out on the 25th. That is posted on the communicable disease information page. It's kind of buried. It's really meant for guidance for the health department so that we can give you guidance, which we've already done, but I just wanted you to be aware that the guidance from the MDHHS did come out on Tuesday. So we gave you a little bit of a jump on that, but that is out there now. I will let you know that there is one big difference. We did allow for waiving of quarantine for exposures on school buses if mitigation measures were being followed. The guidance from MDHHS does not. It only allows for classroom exposures to allow for waiving of quarantine. So I just wanted to make that clear in case, talking to other superintendents or other school districts, there's that discrepancy. That was very intentional. We felt that was a pretty low risk situation in most cases and leads to a lot of quarantines. So I just wanted to let you know that was an intentional difference, not a mistake. I put this in here, in case any of you do have camps at your facility or, just know of people having camps over the summer. If anyone needs information about having, whether it's day camps or residential camp, there's a lot of good information out there. Lara has specific guidelines that are supposed to be followed for licensed camps, but then the CDC has information. The American Camp Association actually has a really good guide on pretty much everything you should do. And then the American Academy of Pediatrics has some guidance as well. So I just wanted to share all that. And again, this will be in the slides that we share and post on the websites for the health department. So now getting to our data, things continue to improve. So for the state as a whole, our daily cases per million went from 174 to 121, and percent positivity went from 7.7 to 6.1. For the 6 counties of Central Michigan District Health Department, our daily cases per million went from 208 to 144, and percent positivity went from 9.2 to 6.6. As you can see, we've had some fluctuations. We've had some counties that still are jumping up into the 200s again, but we've had some that are like Roscommon down in the 50s. and Clare and Gladwin are in the 90s. Some of those counties like Gladwin and Roscommon not too long ago were very, very high. So, you know, kind of a wide range, but overall things are improving. The 10 counties of District 10, the average is at 152, 115, down from 152, and percent positivity is at 7.3, down from 8.8. Again, many of these counties were over 20% positivity, so we're seeing a big improvement. And again, we have some that are in the 60s, and just Newaygo County is still in the 200s, but still it is a lot better than previously had been. So the 3 counties of Mid-Michigan District Health Departments at 171 was at 248. Percent positivity 8.4 was 9.2, and same thing, seeing big improvements over what previously had been occurring. We'll send that out to all of you. Looking at the state data review, this is a pretty busy slide. I probably should have split it up, but our positivity continues to decrease and has been over the last 6 weeks. Our case rates have been continuously decreasing for 6 weeks. Michigan is no longer the #1 for daily cases. We're now the 3rd highest for number of cases and case rate in the country. So luckily we're not the winner at being the worst anymore. So that's good. Our inpatient hospitalization for COVID is decreasing, but unfortunately we still have the highest inpatient bed utilization and ICU utilization for COVID. So that's discouraging, but our death rate is decreasing, and fortunately, we're not the highest for deaths from COVID. So that is good. We have been seeing some decreases in outbreaks overall, and the highest number of new clusters have been in athletics. But I think, you know, again, we kind of look for those the most in our schools. The percent positivity trend, again, continues to go down. We're still not down to our lowest, but we are still going in the right direction. Cases per million, this top one is the last 3 months. We are getting close to where we were at one point. And the bottom one here is from the beginning. And again, you know, we are getting close to where we had been at one point. And this is statewide. These are the age groups. The age groups are still trending in the same order, where the age group with the highest number of daily cases per capita is the 10 through 19-year-old, but they are really clumping together and starting to converge. So hopefully everybody will keep decreasing. 77% of Michigan's viral strains that are genotyped are the B117 variant, compared to the country as a whole, which is 66%. So Michigan, for some reason, we just have more. And I was reading an interesting, reading the transcript to a podcast that a very smart person did, and just about how interesting it is that, you know, Indiana, which shares a border with us, and Illinois just did not have the same incidence of B117 as we did. And there's really no rhyme or reason as to why that happens. So again, we just got hit really hard with this, but you can see in the country as a whole, this blue piece here is kind of the wild strain, or the normal kind of COVID, and you can see, you know, it's just gotten smaller and smaller. So the normal variant now are these more spreadable variants, and you can see we only have 4 counties left that haven't been affected, and likely they have, we just haven't found it yet. So many of our counties, in fact, I would say the majority of our counties have more than one type of variant that have been found in it. The percentage of ER visits that are for COVID-like symptoms has gone down dramatically. It was, I think it was almost 12% at one point. Now we're down to 2.8%. So that is a good thing. I'm sure our emergency rooms are very happy about that. And the hospitalization trend is down dramatically. At the high, it was 4,200 people were hospitalized for COVID. And now we're down to 1,300. So we're not down to where we were, but we're getting there. So that's always been the biggest issue, was just our healthcare capacity. Testing turnaround time continues to be stable and continues to be good. I just wanted to remind people that we do still have a lot of these pop-up testing sites around the state. It's kind of tricky to find it. You have to go into the K through 12 section on that resources page that I had showed you, and then scroll down and there's a pop-up testing site that you can click on. It's nowhere else on the state website. I don't know why it's so hidden, but the link directly is right here. But there are some, like at the welcome centers, are there pretty much every single day. The neighborhood sites are there almost every day. There aren't a lot of those around us, but there are some other pop-ups. And if for any reason you have desire to hold a pop-up, I can put you in touch with the people that can help you with that. But yeah, just a reminder that there are testing opportunities like that around the state. The other thing, for those who may not know it, you can get over-the-counter COVID testing now. It's about $10 a test. 2 tests come within this pack. The reason why 2 tests come in this is if the recommendation is, and all the instructions are in there, but if you test negative today, it's recommended that in 36 hours you test again just to be sure. There is some consumer guidance on how to do self-testing. There's some good instructions and just some advice on what to do and what to do if it's positive and who to notify. But I just wanted to point that out, that if you have league athletes, or just if people are having a hard time finding testing, I put the website link here for Walmart, but you can buy these at Rite Aid or pretty much anywhere. You can just buy them right off the shelf. The outbreaks overall for schools, it says here that they did increase, but new outbreaks, the number of new outbreaks did decrease, I believe. So I know it's kind of confusing to look at all those bar graphs. So I'll just skip to our 19 counties. We did see a jump in our new outbreaks. Last week we had 1 new outbreak. This week we had 6 extra. So we had 7 new outbreaks in our 19 counties, which, again, is not a huge number overall. We have been having a lot of ongoing outbreaks. Again, they have to have no new cases for 28 days to drop off of that list. And so we had 15 outbreaks that have finally dropped off that list. So we only have 1 ongoing outbreak that's still going. I wanted to share some information about our vaccination status for different age groups. This is showing the percentage of individuals that have gotten at least 1 dose. And the darker red it is lower percentage. The more green or blue it is the higher percentage. So on the left here, top left, is for all ages. They are now doing it from 12 and up. So it's all individuals 12 and up. And then, it's 12 to 15 years old, 16 to 19 years old, and so on. Just to give you an idea of how your county may be doing, I know these are really tiny, but like so many other things that our counties struggle with, we do have issues with kind of our rural, central counties getting people vaccinated, and we are working very hard on that. But there is some resistance to vaccination in certain pockets of the population. But I just wanted to share how this is looking, and then also for our health departments. So the 6 counties of Central compared to Michigan, and all 3 health departments are just slightly below the state average. But again, we're in an area where that's not unusual. So I'll just kind of freeze here for a second. And I'm kind of focusing more on the 12 through 19, just because that's our school age kids, but also you can look at your working age individuals. The 10 counties of District 10, and then the 3 counties of Mid, and Clinton County has some pretty high vaccination rates. So they, I think, are a good driver for pulling some of these numbers up. So in terms of vaccination, if you have people that are interested, or if you want to promote vaccination any further, one of the easiest ways is just go to vaccinefinder.org. Once you find a COVID vaccine, you can choose between the 3 different vaccines. You want to just click on the Pfizer vaccine to find vaccines for those that are 12 and above. And it'll find anywhere from 10 miles within your zip code to 50 miles within your zip code, anywhere that has that vaccine available for that age group. Specifically within our health department areas, Mid-Michigan District Health Department does have Walmart Pharmacy coming into a few of their schools. The information is on their website, but they're coming into DeWitt High School, Vestaburg Schools, and Ithaca High School. And then at Central Michigan District Health Department, we have some appointment only opportunities, but also then some pop-up clinics. So today, actually, they're vaccinating at Reed City High School. And these are the ones that are just for Pfizer that I'm talking about for all of these health departments. There's numerous other opportunities for ages 18 and up. But at Reed City High School, in Clare, there's a pop-up. Oh, I'm sorry. And then there's several other pop-ups in Clare, Mount Pleasant, and Standish High School, Standish Sterling High School. So you can set up appointments. It is useful with the 12 to 18 age group when they're minors to have that information ahead of time. But if you have a parent with you, you can just walk in. For District 10, you can walk into any office on Tuesdays and Fridays, or they have different pop-up clinics in a large number of their counties at different events. And this list is growing every day. So you can check their website, dhd10.org/COVID-19 vaccine. You can schedule ahead of time. You don't have to, but again, if it's a minor, they're going to need a parent or guardian with them when they go. So again, just another reminder, we'll meet again next week, same time, same place. And then after that, we'll stop with our weekly meetings, but just contact us if you have any questions or concerns. Our contact information, mine and the health officers, and the just general website for all the health departments is on every one of these presentations if you do need it. So with that, I'm going to stop sharing and I'll get to the questions. If you have any questions, add them in the chat box. And then at the end, if there's anyone on the phone or that can't get into the chat box, we will open it up to those questions. So I think the first one here is, from my understanding, the testing order from athletes expires on May 31st. Is that your understanding as well, or has it been extended? It is in the order that starts June 1st as well. So it's already been extended as of June 1st. So if you go into the epidemic orders, read the order that starts June 1st, and you'll see that it already has been extended. I'm not sure when that expires, but I'm assuming it's going to be July 1st because that's when the epidemic orders are all supposed to change again.
Dr. Morse? This is Chris Griffin, and we just got something just a little bit ago from the MHSA that says effective immediately, both indoor and outdoor out-of-season summer workouts, summer conditioning, and other summer out-of-season activities allowed by MHSA are not required to test participants on a weekly basis.
Well, let me go.
I have what we got earlier today, so I was expecting something from the MHSA, and it came out today, and then we have a Zoom with Mark Ewell at 11:30 tomorrow. But I'll forward that to you, what we got from him, just so you have it, because obviously there might be some confusion again.
Yeah, so in the June 1st, in the epidemic order that starts tomorrow, or June 1st, gatherings for the purposes of sports practice and competition involving persons aged 13 to 19 are prohibited unless all such persons comply with a testing program as specified in the MDHHS publication entitled Interim Guidance for Athletics, issued May 24th. For gatherings where sports organizers have determined that it's unsafe for indoor sport participants to wear masks, blah, 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 you have to follow that testing. And so the interim guidance for masks, let me go to that one. So the interim guidance for sports, did they change that? Unvaccinated participants ages 13 to 19 participating in contact and non-contact organized sports must test on at least a weekly basis. So according to the order that takes over on June 1st, to me, it looks like nothing has changed. So I would encourage you to read what the order says, and then you'll have your questions ready for MHSAA. So, many of us are operating summer school programs, some of them starting in June. Do you have any insight what protocols are going to be in place for summer school before June 1? So again, it's recommended at this time that everyone inside a school building wear a mask. It's not required that people that are fully vaccinated wear a mask at this time. The CDC did say that they will be updating their recommendations within the next several weeks. I don't know when that'll be or what it will be. So pretty much all that I know. And we'll keep you posted. So I would just keep an eye out on the operational guidance for schools on the CDC website. But you're right, supposedly the Michigan rules to require masking will go away completely as of July 1. Again, those are the laws, not necessarily the recommendations. So the next one's just about MHSAA. The next one's just about MHSAA. Oh, Melissa's just correcting. I copied and pasted the information about the CMDHD clinics, and there was an error, and I'll fix it on our slides before I send them out. But the clinic at CMU Student Activity Center is Tuesday, June 1st, not June 2nd. So again, I will correct the slides before we send them out. And there'll also be Johnson & Johnson vaccine at Reed City High School vaccine clinic tonight. I think almost all of Central Michigan's vaccine clinics, they also have Johnson & Johnson. At District 10, all of their vaccine clinics, they have all 3 vaccines. So just as an FYI. And again, I just listed the clinics that have Pfizer there so that you knew which ones were applicable to your students. If someone does an at-home COVID test, are we to take their word for it that it was negative? Can you advise? I know well, you're supposed to, and I know that's not a great answer. again, I would read the CDC webpage on that. It does give you some good guidance on how to handle those results. With the Binax now, at least in the beginning, I don't know if they still do or not, but they actually had a human being that would FaceTime with them and walk them through doing the test and would visualize the results of the test and give them a somewhat formalized test result paper or, screenshot or something so that they had an actual lab result that they could then present at, if they were flying home and needed it for the airlines or things like that. And to me, that gives it a bit more ethnicity or authenticity because someone else is looking at it. But we have had a lot of discussions. I know my colleagues have had a lot of discussion about this. If someone is symptomatic and it's negative, they are supposed to get a PCR test for confirmation. So you would still follow that same algorithm that you followed for sports testing. If they're asymptomatic and it's negative, then you are to trust that. But again, if they're symptomatic and it's negative, they're supposed to get a PCR test anyways. Like if I were doing that test in a doctor's office for a patient, I'd make them get a PCR test anyways to confirm it because there's a risk that would be a false negative. If you have questions about that at all, feel free to contact us and we can help work you through that. Or tell them to call their doctor. That's what the CDC actually says to do, is have them call their doctor. Yeah, and then there's a copy paste from Michigan High School Athletic Association. I'm not going to read through it. I just know that Michigan High School Athletic Association has been wrong several times in the past. So, so I'm just reading what the state order says. Are we still required to test for prom? You were never required to test for prom. It was an option in the state guidance for safe end of year activities. One option was that you could test, but you're not required to. My OSHA rules for non-vax employees wearing masks are through October 14th. Yes, so my OSHA, their rules do go through October 14th or basically 6 months or until they change them. So the July 1 change would be for the general public, if it does happen. So again, that's just what the governor has said she would do. So I don't tend to believe things until I see the ink dry. So I don't know. It said I had another message, but I think that's the end of my questions that I have here. If anyone has any other questions, you can add them or feel free to unmute and ask away. All right. Well, we will get out the PowerPoint and the data set. And we'll talk next Thursday. And if you have questions sooner, let us know. Have a great weekend, you guys.